Hello, my name is Laura Mosqueda. I'm the Dean of the Keck School of Medicine, and I'm delighted that we can show you what the next phase of your training could look like. July 1st is a very exciting day.
The lab coat, for sure.
Yeah.
We go from like a short coat to a long coat.
It's when I welcome our new interns, residents, and fellows.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interests supersede self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yep.
Okay.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Diggs in here, please?
Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new? No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, but equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Good morning, everyone. Thanks for coming together. My name is Helena Chu, and I'm the chair of the department. It's been a pleasure and it's an honor. I've been chair for 17 years, and I've seen the department grow, okay, from like 12 residents to 18 residents, and from maybe 6 fellows to 12 fellows. You're all here for different subspecialties. We have about 10 subspecialties in critical care, neurology and stroke, epilepsy, headache and general neurology, Parkinson's and movement disorders, ALS, neuromuscular disorders, Alzheimer's disease and memory disorders, multiple sclerosis and neuroimmunology, rehab in both inpatient and outpatient. Our history goes back over 100 years. We started out as a training program at the General Hospital. It's kind of famous on TV, LA County. We've been like a family between neurology and neurosurgery. And I think that's been the key, because kind of with pride, we are number 19 by US News and World Report for neuroscience. So that's, you can hold your head up high when you say you trained at USC. It's kind of hard for me to believe, number 19. During the past 10 years, the university has made major investments in neuroscience. Our NIH funding ranking moved from number 30 to number 4. So we have, just looking out the window, the ZILCA, Neurogenetics Research Institute, and right there, the Broad Stem Cell Regenerative Medicine Institute. We have the Stevens Neuroimaging and Informatics Institute, a beautiful space with lights. It looks like a spaceship. There's over 15 faculty members there, and they're part of the Department of Neurology. If you're interested in research, we have a lot of opportunities here. And we've come a long way in the 17 years I've been here. Our goal is still to train the best experienced, skilled, compassionate clinicians. Welcome to our academic community and home, and to our family. Your program director's doors and my doors always open to you.
Hi, I'm Daniel O. I'm one of the third-year residents at LHC USC Neurology program. Ben and I are here to talk about some of our program highlights and give a quick introduction.
Hi, my name's Ben Stewart. I'm a third-year neurology resident here at LHC USC.
Hey Ben, so what makes LHC USC Neurology really special, and can you tell us some of the highlights?
Yeah, so the first thing that comes to mind is the patient population. The patients that we serve at LA County as well as the Keck Hospital are some of the most socioeconomic, culturally, medically diverse patients in the world. I think that the combination between the safety net hospital at LA County as well as the private hospital setting at Keck really provides a nice breadth and depth that's really, it's unmatched. I feel confident that after graduating from this program that I'll have the tools necessary to practice wherever I would like to.
So Ben, you bring up two different hospitals here, LA County Hospital and the Keck Hospital. Can you go into a little more detail about each hospital?
Sure, yeah, absolutely. So in our residency, we spend most of our time at LA County. LA County is where we are split up between two teams. One is a primary neurology and consult service, and the other is a vascular stroke team. Each team has their own attending, their own rounding times. We round usually twice in a day. At some point, either before or after our second rounds, there's dedicated time for a chalk talk by the attending faculty, talking about whatever is sort of pertinent at that time. The ED is where we get most of our consults from that. I mentioned the primary and the consult service. We get a lot of consults from the LAC ED. It's a very busy emergency department. And the ED honestly never fails to provide a number of rare and interesting cases, as well as bread and butter neurology cases.
Can you go over some of the cases you've seen?
as neurology in the emergency department, one of the most common things that we get called down for is strokes. That's where my first stroke code was. It was also where my first status epilepticus, and some bread and butter movement disorders like Huntington's. That was also where my first cases were.
Can you go into a little more about the Keck Hospital? I mean, I know it belongs to USC, but how is it different from county exactly?
Absolutely. So even though we spend most of our time at LA County, we do spend 3 months in our second and third year at Keck Hospital. At Keck, although they don't have an ED there, it's still a functioning hospital because we get a lot of transfers as direct admissions from other hospitals that are requiring specialized neurologic care, so either tertiary or quaternary neurologic care. It's also split up between 2 teams, so you'll either be on a dedicated neurohospitalist service or a neuro ICU, neurocritical care team. And each of those teams also have their own dedicated attending. I think our neurocritical care team actually is one of the strengths of our program. We feel really comfortable, I think. I don't know, you can tell me if you feel differently, but I think we feel pretty comfortable managing aneurysmal subarachnoid hemorrhages, cerebellar sinus venous thromboses, just to name a few.
What are the call rooms like in county and Keck?
So at both LA County and Keck, we have our own call rooms, and they're actually really cozy. We've spent a lot of time trying to make them a little bit more cozy.
So Ben, you're a big coffee drinker, I know. So how's the coffee quality here? How much do you pay for? When do you get them? Where do you get them?
So there's a lot of free coffee available. But even if I wanted to pay for it, we get money on our meal cards. So we get $10 per meal at each of the 3 different hospitals that we work at, and get a bunch of extra money if we're working off-site. Dan, why don't you tell me a little bit about some of the unique learning opportunities that we have?
Yeah, I can get into a little bit on that. So I think I'm most proud of our sim lab, the simulation lab. We have a specific session, a half-a-day session for especially our juniors, where we do stroke sims, status epilepticus sims, and other neurocritical care sims in emergency cases.
A little bit more, what did the CT scan show?
Oh, the CT scan showed possible hyperdensity in a segment of the MCA on the non-con.
Doing that in the earlier part of the training really strengthens the incoming junior residents who are new to these emergencies, and our faculty are super engaged. They give direct teach back. They are behind the walls watching at all times on a microphone to guide you along the way. So I really like that feedback in the beginning, and it really prepped me for the rest of the year. And they do a pre-quiz and a post-quiz where you get to test your knowledge base as well. So I'm really proud of the sim lab, especially.
I know you're pretty passionate about research and some other things, if you want to get into that a little bit.
Yeah, we're very proud of the amount of research and publications, posters, abstracts we've put out in the past couple of years, all together from headache projects, community projects, to especially critical care and stroke projects. We have attendings who are really actively publishing, so you can get into areas of interest really easily. They're a phone call away. And you're not alone, because in the beginning we can do a mentor setup in the beginning. So as soon as you find an interest, we plug you in right away with an attending, so they can mentor you along the way. And we also have funding for that too. We pay for a conference, national conference, as well as poster printing. So a lot of resources. All you need is just your touch of interest, really.
Just kind of to add on a little bit to some of our funding, I know the CIR, our union, provides quite a bit as well, I think, right? Do you mind talking a little bit about that?
Yeah, they actually provide $1,000 per year for what includes iPads, laptops even, that helps your academic learning. There's a lot of help, a lot of resources for us to learn, and as long as you take advantage of it, I think it can really enrich your program and learning experience here.
I was thinking about the $4,000, the housing stipend.
Oh yeah, the $4,000 housing stipend really helps throughout the year too. I want to talk about just one more thing. I think that's outside of LAC, USC, and Keck. We do have a unique rotation at Rancho Los Amigos, which is in Downey, LA, and Children's Hospital of LA. Rancho Los Amigos is a national rehab center, very well known actually. It goes way back, and you can see some interesting cases in their epilepsy modern unit, stroke units, and they have a lot of joint multidisciplinary projects and clinics with dementia and neurosurgery cases. The other one, Children's Hospital of LA, or CHLA they call it, it's #1 hospital, children's hospital in the West Coast. The cases you see there are amazing. I mean, these kids are sick, but I don't think you can get any more, better exposure to pediatric neurology than that. And you really get, really come out learning a lot about epilepsy and your medications. So we're really proud of that kind of learning opportunity.
Mm-hmm.
Yeah, Ben and I got to really connect over rock climbing. We've done picnics, and really LA is a great spot to build friendship and work together. So to me, Ben is a family, and we really try to enrich that more outside the hospital too. But if it's a really bad night, we sometimes eat together before we go home, or cover more cases or consults, and we really work outside of our strict regulations of hours and whatnot. So I think there's a lot of help and cross-covering.
Mm-hmm.
And we're always here to help, really.
I guess it'd be interesting to hear what you, now that we're talking to some applicants right now, what you would say to yourself during the application process, what you would say to a younger Dan.
I think two things probably. I think I was looking for somewhere like LAC, USC, where there is the safety net population as well as a private side. So I wanted to be kind of fluent in both, populations. But so look for a program where you want to practice and where that can build you to be the person you want to be. So I think that was a great fit for me here. The other thing is talk to your core residents, your senior residents. You learn so much from what they've learned, and there's no dumb question. You ask anything you want. The more you ask, you really get to learn more. So don't be afraid of asking questions, and find a good geographical or urban fit for you.
Yeah, no, I agree. I think the backbone of your residency is going to be the cases you see, the patients you see, and I really do think that we see some amazing stories, some amazing cases at LAC in Los Angeles. One of the things I really feel like I appreciated during my application process was being able to talk to the residents. I really do think that you're spending a lot of time with these guys, and it means a lot when you can hang out with them and you really enjoy the people you work with.
So Ben, I feel like you're getting to the culture part of the program. I mean, it's hard for the candidates to gauge, what the culture is like versus virtually. Everyone's putting their best foot forward. Can you go into just a little bit about, how our working culture is, how the faculty are like?
So I think the culture between the residents is really congenial. I think everyone works really well together, and people are really interested and are always available to talk to each other amongst residents, but amongst the attendings, I think, as well. So we text with a lot of the attendings, and they're always a text or a call away. I never really feel like I can't reach out to them. So I think that kind of gives you a sense of what the culture is within our entire program. Talking about getting to know our residents, I know you worked on a kind of a new website for our residency. Yeah. Do you want to talk about it a little bit?
Yeah, sure, I did. It was a small brainchild project of mine, but I feel like it's important to portray, in a virtual sense, who we are, and this is, it's not an unknown. And it's a small project, but I took in small interests of each person in the residency program, and I wrote a little blurb with a touch of sarcasm, and I think it went well. It's enjoyable to read, and so I think that's a good way to find out who we are and come take a look.
Yeah, I agree.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.